Did you know that your face can reveal problems about your health from the inside? Your face is trying to tell you something. That yellow tint in your eyes could be your liver screaming for help. Those dark patches around your neck that won't wash off, maybe that's an early warning sign of diabetes. Those cracked corners in your mouth that you keep on blaming on dry weather, your body could be missing a critical vitamin. As a double board certified plastic surgeon and physician with 23 years of experience, I often tell more about someone's health in 30 seconds of meeting them than from an hour conversation, because the face doesn't lie. Today, I'm going to show you exactly what to look for in the mirror. Signs that most people completely ignore. Signs that can catch serious conditions years before they become dangerous. Let's start with one of the most obvious but most ignored warning signs. Pull down your lower eyelid right now. What color do you see? It should be a healthy pinkish red, but if you're seeing yellow, that's a problem. Yellow eyes or yellow skin is called jaundice, and it happens when your liver can't properly filter a substance called bilirubin from your blood. Bilirubin is yellow. When it builds up, it literally stains your tissues. Here's what's scary. Jaundice can be a sign of hepatitis, gallstones blocking your bile ducts, cirrhosis, and in some cases, pancreatic cancer. Now, a quick note. If your skin looks yellowish, but your eyes are perfectly white, you might be eating too many carrots or sweet potatoes. That's called carotenemia. It's harmless, but if those whites of your eyes are turning yellow, that's your liver talking, and you need to see a doctor immediately. One more thing. Jaundice often starts under your tongue before anywhere else. So if someone tells you, hey, you're looking a little yellow, take it seriously. Now let's talk about the opposite problem, looking too pale. Again, pull down your lower eyelid. Inside should be a vibrant red color. If it's pale pink, mostly white, or yellowish, you might be anemic. Anemia means you don't have enough healthy red blood cells to carry oxygen throughout your body. And what's the most common cause? Well, it's iron deficiency. And here's the thing. Your skin gets its healthy glow from blood flowing beneath it. When you're low on red blood cells, that color fades. You look washed out, tired, like you haven't slept in weeks. Other signs to watch out for are feeling exhausted, or even after a full night's sleep, getting wound down or tired doing simple things, cold hands and feet, and this is a weird one, craving ice, or even non-food items like dirt. That's called pica. That's a real symptom of severe iron deficiency. The next one flies under the radar constantly. Look at the inner corners of your eyelids right by the nose, on the skin. Do you see small yellowish bump patches? They might look like little fatty deposits sitting just underneath your skin. That's called xanthelasma, and it's essentially cholesterol collecting underneath your skin. A major Danish study showed almost 13,000 people for over 30 years. They found that people with these yellow eye deposits had a 51% higher risk of heart attack, even after accounting for other risk factors. They also had a 17% higher risk of dying during the study period. So if you notice those yellow patches appearing around your eyes, don't just write them off as a cosmetic issue. Get your cholesterol checked. Get a cardiovascular assessment. Your face might be warning you about what's building up in your arteries. Have you told people that you look surprised all the time, or that eyes seem wider than they used to be? Bulging eyes, the medical term is exophthalmos. That can be a sign of thyroid problems, specifically an overactive thyroid causing something called Graves' disease. So here's what's happened. Your immune system mistakenly attacks your thyroid and your tissues behind your eyes. Those tissues swell up and push your eyeballs forward. About 1 in 3 people with Graves' disease develop these eye symptoms, and it's not just cosmetic. It can cause dry eyes, double vision, light sensitivity, and in severe cases damage your optic nerve. Other signs of thyroid problems to watch out for: unexplained weight changes, feeling too hot or too cold all the time, anxiety or mood swings. If your eyes are starting to bulge, especially if that's happening quickly, don't wait. This needs medical attention. This one is incredibly common and almost always misunderstood. Dark velvety patches of skin, usually around the back of your neck, your armpits, and in your groin. Many people think it's dirt. They scrub harder. it doesn't come off. But it's not dirt. It's called acanthosis nigrans, and in most cases, it's a visible warning sign of insulin resistance, the precursor to type 2 diabetes. Here's the science. When your body becomes resistant to insulin, your pancreas pumps out more and more to compensate. That extra insulin floating around in your blood activates your blood receptors in your skin cells, causing them to multiply faster and produce more pigment. The American Diabetes Association officially recognizes this as a risk factor for developing diabetes. Studies show that up to 74% of obese individuals have some degree of darkening. So, if you've noticed these dark patches and you've been ignoring them, or worse, feeling embarrassed about them, please get your blood sugar checked. This is your body giving you an early warning sign. Catching insulin resistance before it becomes full-blown diabetes can literally change the course of your health. The last one, and this affects more people than you think, painful cracks and sores in the corners of your mouth. They split open, they sting when you eat, they keep on coming back no matter how much lip balm you use. This is called angular cheilitis, and while it can be caused by fungal or bacterial infections, one of the more common underlying causes is nutritional deficiency, specifically B vitamins and iron. Research suggests that up to 25% of cases are linked to low iron and vitamin B levels. If you're vegan or vegetarian, you're at higher risk of B12 deficiency, which commonly shows up in these cracked mouth corners. Other signs of vitamin B vitamin deficiencies are swollen, inflamed tongue, fatigue, and in severe cases, nerve problems like tingling in your hands and your feet. If these cracks keep on coming back despite your treatment, ask your doctor for a blood panel checking your vitamin B12, folate, and iron levels. The fix might be as simple as adjusting your diet or taking a supplement. Your face is a window into what's happening inside your body. These aren't random cosmetic issues. They're your body's early warning system. So take a good look in the mirror, not for vanity, but for your health. And if something doesn't look right, don't ignore it. Don't be embarrassed. Get it checked. Catch these things early and it can change everything. I'll see you on the next one.